Well, recent studies have found that hydroxychloroquine does not reduce COVID-19 deaths. It also found that it may actually cause unwanted damage. These findings were released in a joint study published by authors from India, the UK, and South Africa. Now, one of the co-authors of the study, Dr. Tamara Kredo, joins us on the lead. Doctor, thanks for your time. We do appreciate it. So overall, you're saying hydroxychloroquine does not have any major effect in the treatment of COVID-19?
No, I think that's exactly right. Our study, which is called a systematic review, basically collects all the data and summarizes all the data from all the available trials that could answer this question. And we can definitively say hydroxychloroquine is not an option to treat COVID. So we can close the book on that. And in fact, not only does it not reduce deaths or ventilation, the kind of major things we want to reduce, it has a threefold increase in harms, so side effects that are unwanted. So I think we can quite safely say, chloroquine is not the treatment for COVID, and we can move on. We need to explore other options.
Yeah, we know that hydroxychloroquine was brought into the country illegally. So let's talk about the side effects if people are still urged to somehow use this drug to treat COVID-19. What are they?
Yeah, absolutely. So most of the side effects that we saw in the trials are relatively mild side effects, gastrointestinal side effects, headaches, other similar kinds of effects. The one that worries people sometimes when you look at these kind of medicines is kind of disturbing the heart rate and kind of stopping the heart. And there were some of these reported in some of the earlier trials, but that wasn't the overwhelming thing. It was kind of just this mass of milder side effects that people were getting. And maybe if I think about it in the context of care in South Africa, people are taking chloroquine, they're also taking zinc and other things that are not recommended. And all of those together cause diarrhea and other gastrointestinal and other side effects.
We've seen so many things come up on how to treat COVID-19, many of them untested. Ivermectin, I just spoke to officials last week. They now have a new study saying that it's actually not as effective as people believed. This hydroxychloroquine, where did this emerge? How did it become so popular in this fake belief that it is the right medication to treat COVID-19?
I think there are lots of great parallels that you can draw with ivermectin and hydroxychloroquine. So chloroquine a year ago in March we were first hearing about chloroquine working in vitro, so working in test tubes actually. And some fake reports were published on Google documents that Elon Musk took up and Trump took up and went with it with the hydroxychloroquine. And it caused a massive impact in kind of policy and other work that was happening. And although with hydroxychloroquine, the early trials were also not showing no effect, but it was only when we had the larger trials like Solidarity, the one that South Africa also participated in, that we kind of definitively could see that it doesn't work. Ivermectin, similarly, it's almost like we are where we were with hydroxychloroquine in March last year, where you have these small early trials that suggests something, but you can't tell definitively. So we're left in this place of uncertainty with ivermectin, and I'm fairly certain that we'll have more clarity as the new trials come out, which they haven't yet.
People are very desperate, of course, to seek treatment, especially since we're waiting for vaccines, a proper rollout in this country. And what's your advice to South Africans who are trying to ultimately save their family members' lives, and then they fall for the, fake news that these drugs actually work?
Yeah, absolutely. And it is a desperate space. But, I know this is, it's not news, but there are things that do work. And what works is keeping a distance, wearing a face mask, and doing your hand hygiene. And I know we all look for pills for every ill and, magic bullets. But when something says it's a miracle cure, your red flag should go up that there are no miracle cures. And we really need to stick with the public health measures that we know about. Medicines all have side effects. You'd rather not take them unless you really need to. And I'm a medic myself, and I feel for the people that are in desperate situations and wanting to prevent getting ill and wanting to prevent their patients from getting ill. But prescribing unrecommended medicines and perpetuating the illegal use of medicines is really, really not helping anyone.
And Doctor, just one last question in terms of this trial. Of course, it happened across several countries, South Africa being one of them. I'm reading that pharmaceutical companies that actually manufacture hydroxychloroquine funded some of the studies that show its ineffectiveness in the treatment of COVID-19. So that in itself will tell you that the people who produce this drug is saying, hold off, it's not safe to use for COVID-19.
Mm-hmm. Yeah, I guess so. I mean, the beauty of this review that we did, which is a Cochrane review, which brought together 9 trials to answer the question, which you can imagine increases your power to answer the question. A lot of them would have worked with the drug company to provide the medicine. But ideally, in a trial situation, the pharmaceutical company providing the medicine shouldn't have any say in how the results are interpreted. Otherwise, the results become biased. Yeah.